Yeah, so stroke is a condition where we really need a large multidisciplinary team to give the best outcomes, for stroke recovery. And that team, it starts initially with the neurologist, and coming in and diagnosing the stroke, usually in an emergency room setting. And then also with the internist there, working with the neurologist, making sure we're modifying risk factors and preventing, future strokes. But then we really transition to this bigger portion of the team, which is the rehab side of it. And that is going to be the part that's going to be led by typically a physiatrist, someone trained in physical medicine and rehab, overseeing the rehabilitation care with multiple other specialists, which would be our physical therapist, occupational therapist, speech therapist. Then we also have things like our driving specialist to get people to return to driving post stroke, and a vocational therapist. If we're talking about going back to work, we could include our psychologist helping with the adjustments, to all the changes in our life post stroke, maybe a neuropsychologist looking at our cognitive abilities and what level of work are we going to be able to return to, and what things do maybe we need more help with. Even if we're not returning to work, I had a gentleman in his 80s who wanted to return to driving and wanted to live independently, but we definitely had concerns with that happening, so we did have a neuropsychologist do objective testing to really break that down. So we had more objective data to sit down and explain to him our concerns with him, returning to a completely independent lifestyle and what safeguards we needed, in place. We also will have orthotists involved when we need braces, which are a common thing that we will prescribe in post-stroke recovery. We will have our assisted technology professionals, which are people that specialize in all kinds of adaptive equipment. Do we need a power wheelchair? Do we need lifts to help, transfer in the home? And they'll get involved, and we will work with them on making sure that we get all the right equipment to give the best outcomes for patients post stroke. So it's a big team, and that's where typically, the physiatrist will be the one kind of leading that team and will be the point person working with all these different specialists and making sure patients are getting where they need to when they need it, so that we don't miss any aspect of the care. Access to this, comprehensive multidisciplinary care team is really important to have the best outcomes after stroke, because this is where it's always scary when you have a stroke and you come in and you're told you have a stroke and it's a blockage here and this is the treatment we need, to move forward. But then people are left with, what does this all mean? How does this affect my life? How can I get back to my goals? And that's where, as this whole, care team, we will really come in and we will work with the human. We want to get to know that individual, what makes them tick, what is their goal to get better, and goals can be very different. It can go from my, 80-year-old who wants to drive his car and live alone, versus I have another gentleman here in my unit right now. He wants to wash his armpit, but his hand is weak and he can't reach his other armpit, so those are things that we have. I have a young gentleman who had a stroke and he wants to golf, and he didn't get great recovery in his other hand, but we were able to get that goal. He learned how to golf one-handed, and he's doing a great job at it, but that's with working with, all these different specialists. And, we might need to get some different equipment to get them back into their sports. I have a lot of hunters that I see, and they might need a crossbow to be able to go hunting, and, different types of equipment. And there's ways to do all of that. So we need that whole care team to really get to know the person, know what their patient-centered goal is, so we can help direct them to all the specialists that are available to make sure that they're safe and reaching their highest potential.